Hello everyone, I hope you all are doing great. And in today's topic, I'll be talking about the normal morphology of neutrophil, what features you will see in neutrophil and bacterial infection, what are the conditions you will see in neutropenia, and what are the conditions you will see hypersegmented neutrophil, and what is pseudopelgic anomaly. So, the neutrophil, as you all are well aware that it is arising from the hematopoietic stem cells in the bone marrow. So, this will undergo myeloid progenitor cells, then forms the myeloblast, then forms the promyelocyte, myelocyte, metamyelocyte, band form, and then forms the neutrophil. I have not mentioned the morphology of each cell, guys. So, I will put the link in the description box below. The video I have made is the hematopoiesis. Okay. So now coming to the neutrophil. The neutrophil is a cell of the innate immune system, and normally it is 54 to 62%. And looking at the normal neutrophil, it does have 3 to 5 lobes, and it has a fine granules, and those are the eosinophilic granules, and it also has a specific granules which contains the leukocyte alkaline phosphatase. Now the features in neutrophils you will see in bacterial infection is there is coarse granules. You can see these granules are coarse, and those are the toxic granulation, unlike the fine granules you will see normally. There is also cytoplasmic vacuoles. You can see these holes, and also there is a blue, you can say that basophilic cytoplasmic inclusion, and that's a remnant of the rough endoplasmic reticulum. That's called the Dooley bodies, and that is indicative of bacterial infection. So three features indicative of bacterial infection in neutrophil is Dooley bodies, cytoplasmic vacuoles, and toxic granulation. And neutropenia, as you all are aware, the neutropenia is low neutrophilic count, and the conditions where you will see low neutrophilic count is aplastic anemia. Okay, you can see in myelodysplastic syndrome, you can see in myelofibrosis, lupus, drugs like antithyroid, antipsychotics, antibiotics. Okay, and you can even see in chemotherapy, people with chemotherapy can have neutropenia. Okay. Now coming to the hypersegmented neutrophil. So what is the definition of hypersegmented neutrophil? Normally we saw 3 to 5 lobes, but once you see 6 lobes, that's called hypersegmented neutrophil. And it is seen in conditions like vitamin B12 and folic acid deficiency. Okay. So in the peripheral blood smear, the conditions where you will see hypersegmented neutrophil is vitamin B12 deficiency, and second is the folic acid deficiency. Okay. And pseudopelgic fluid anomaly. So this is a feature of, in this condition, the feature of neutrophil is the lobes. There is a hypolobation. There is a hypolobation and there is a hypogranulation. That means there is less granules and there is a less lobes in neutrophil. Okay, that you will see in neutrophil. And these feature hypolobation, hypogranulation, you will see in a condition called myelodysplastic syndrome. So what is myelodysplastic syndrome? It is mainly seen in older population. Okay, in older population, older age group, and then where in the bone marrow there is less than 20% of the blast cells. Okay, so less than 20% of blast cells in the bone marrow, older population. So when you see MDS, then with all this less than 20% of blast cell along with pseudopelgic fluid anomaly, that is hypolobation and hypogranulation of neutrophils. So that's one of the feature that the patient has MDS. So these MDS patients may turn into acute myeloid leukemia in later life. And when we call it acute myeloid leukemia, when there is more than 20% blast cells in the bone marrow. Okay. So I hope this session helped you guys, and in part 2 of the video, as I already said, I'll be talking about um, leukocyte alkaline phosphatase increased, why it is increased in leukemia reaction, why it is decreased in CMF, and I will talk about respiratory burst. Thank you very much guys, and if my videos are helping you, then please like, share and subscribe.